What to expect if someone that you care for has pancreatic cancer. I'm Nicci and I'm one of the specialist nurses at Pancreatic Cancer UK. This video is for family and friends who are looking after someone who has been diagnosed with pancreatic cancer. If someone you are close to has pancreatic cancer, you may be feeling shocked and overwhelmed, and you may have lots of questions. This video will explain what happens next and where you can get support. In this video, when we talk about your family member or relative, we mean the person with pancreatic cancer who you are looking after.
When my dad was first diagnosed, I remember being in a bit of a whirlwind and feeling quite sort of lonely and lost and not really knowing where to turn to or what to look for. And I found the Pancreatic Cancer UK website, which kind of became a bit like my Bible, to be honest. And then I found like all other people's stories on there, which I took quite a lot of comfort in.
Your key medical contacts. When your family member is diagnosed with pancreatic cancer, a team of medical professionals called a multidisciplinary team, or MDT for short, should review the information about their diagnosis. They might not meet everyone in the MDT, but the consultant or specialist nurse should tell them what the MDT recommend. If your family member gives their medical team permission, you can speak directly to them. The doctor will explain the diagnosis and the best treatment for your family member.
If it was a consultant appointment, we'd go in together, and my dad would kind of take his notebook and I would take my phone and I'd write notes on my phone from that point forward. I always let him take the lead, and he was really keen to kind of have that lead as well and not have the control and not lose his independence over that.
Your relative may also be given the details of a nurse called a clinical nurse specialist, or CNS. If they have a CNS, this nurse is your main contact. They can support you and your family member and answer your questions. Or your relative may have a patient care coordinator. This is someone who works with the rest of the medical team to coordinate your family member's care. They may only be available in some hospitals or may be called something different. If you are caring for your relative at home, you should be told who to call if you need help. You could also ask who you should contact out of normal hospital hours or in an emergency. Treatment for pancreatic cancer. There are different treatments for pancreatic cancer. The type of treatment or care your family member can have will depend on the size of the cancer, if it has spread outside the pancreas, and if so, where to. Treatment also depends on how well they are generally. Symptoms they may get. Pancreatic cancer can cause symptoms, including pain, fatigue, and diabetes. Treatments for the cancer, such as chemotherapy and surgery, can also cause side effects. Pancreatic cancer can cause problems with digestion. This can cause symptoms including losing weight, losing their appetite, and changes to their poo. Taking capsules containing pancreatic enzymes when they eat can help your relative to manage this. This is called pancreatic enzyme replacement therapy, or PERT for short. Ask their doctor or nurse about this.
My dad had quite a lot of pain when he used to eat initially. It used to cause him a lot of pain. So they put him on PERT. It definitely did help him, I think, in terms of being able to eat better and experience less pain.
There are ways to manage most symptoms and side effects, so speak to the medical team for help. How you can support them. There are other things you can do to help and support your family member. Talk to them about how they would like you to support them.
I think communication with your loved one is key in terms of pancreatic cancer and understanding exactly what they want. So your opinion might be different, but they will know best what they want for them.
You might be able to help them manage their medicines and keep a diary of their symptoms. You could also go along to their appointments and make notes of what is said to help them remember. You could help with household jobs like shopping or cleaning, or you could take over caring responsibilities for children or other family members. You could also help by preparing meals. Ask them what they would like you to cook, but try not to put pressure on them to eat. They may not have much of an appetite.
I remember I used to cook a lot, and he might just eat a couple of mouthfuls, and sometimes it can be a bit disheartening for yourself if you've been cooking for a long time. You think, what's wrong with my cooking? But I remember one day that I made this chili and he loved it and he ate so much of it. And I tried to recreate this in every possible way and I couldn't. But yeah, I think it was just about a spur of the moment. What do you fancy?
Pancreatic cancer can have a big emotional impact on them, and you can also provide emotional support. Coping with the impact on you. Finding out that someone you know has pancreatic cancer can be scary. You may worry about what the future holds, and supporting someone with cancer can be exhausting and upsetting. So it's really important that you get support for yourself as well. This can help you cope. It can also help you to look after your family member better.
My dad would stay with my auntie, and then for a change of scenery and also for a bit of respite for her as well, he'd come and stay with us, and then we'd switch again and we'd go backwards and forwards. And it allowed everyone to keep fresh as well, because it can be a lot. I think when you're in that intense situation, 24 hours a day, sometimes you need a bit of a break as well. And he needs a bit of a break and a bit of a change of scene, and just having a bit of normality with that. And it allowed us to be, I think, the best possible versions of ourselves for him.
Find someone that you can talk to, whether it's through family or friends, social media or an online forum. The medical team looking after your family members can also support you. You might find it helpful to speak to us on our support line. We are all specialist nurses and we can provide emotional support, talk you through what happens next and answer any questions that you have. Contact our free support line on 0808 801 0707 or email nurse@pancreaticcancer.org.uk. You can also find us online at pancreaticcancer.org.uk.